Hey everybody, Paul Singh here from southeastern Wisconsin. I'm at American Glaucoma Society 2025, and I was just talking to a lot of colleagues recently, and we were talking about this idea again, this new philosophy and mindset, interventional glaucoma, which I know a lot of you have heard of. And we were talking about what does it really mean, and we had a little kind of discussion amongst each other. And what I was thinking for me, what it means in my practice is really, again, not trying to have to basically choose between maintaining high quality life for a patient and being aggressive and really controlling IOP. And it goes beyond that to the point of we're not waiting for things to come to us and things to tell us, oh, someone's progressing, or waiting for someone to be obviously non-compliant before we say, let's be more aggressive, or let's at least control some of those variables. And so for me, how I've utilized and how I've discussed this interventional glaucoma mindset with my patients is really discussing the journey. So when I see a patient for the first time, I tell a patient, look, my goal again is to keep you seeing for the rest of your life, but also maintain the highest quality of life. I have a number of different tools at my disposal to help achieve that goal. It may be a beam of light treatment, maybe delivering medications through the topical drop or through inside the eye. We may have other procedures we can do for you, but the goal is to help keep you at the highest quality of life and protect you from losing vision as well. And so I think having that baseline discussion, setting up the expectation that it may not be one procedure, multiple procedures that may require us to stabilize their eye. And I think it also, when I talk about that, I tell every patient that their anatomy may be different than another person's anatomy. So each procedure may work differently for every patient. It's okay if any given procedure doesn't do enough. We have the ability to try something different. For instance, you do SLT may work about 75 or 80% of the time, and some of those patients, it doesn't have the full efficacy. And the way I tell a patient, let's say of a patient who didn't do enough, I don't say, sorry, the laser didn't work for you. What I say to a patient, it wasn't enough to get you to where we want you to be, so we're going to try something else too. And so I think having those kind of conversations and having the confidence to tell a patient, here's what's next, here's what I recommend. Because I think when you talk about the fear that we have as providers, the fear for me at least a lot of times is, do I want to go in and intervene, whatever that intervention is. Hopefully it's high safety, but the intervention also, we want to achieve our goals, whether it's reduction of IOP or reduction of medication burden. And there's always that fear, what if I do something and I don't get those goals achieved? But the other fear for the patients, is this going to be safe? Is this something that I want to have done? And I think we can mitigate a lot of the patient fears by the confidence in which we present. For instance, we have data on the LIGHT trial, which tells us very clearly, compared to topical medications, that laser trabeculoplasty is a better option. And we have first-line indications from multiple societies. Now I don't really give the choice. I don't say, well, you could do this, you could do this. I say to a patient, Mrs. Smith, I have a beam of light treatment that can help rejuvenate the drain, help your body heal itself, to open the pores up, let the pressures come down. It's covered by insurance. We do it right here in the office. And if it doesn't have enough efficacy, if we don't get you to where you want to be, we have other procedures, other drops, and other things we can do for you if we need be. So I think like that conversation and that confidence is so important to minimize and mitigate some of the fears that patients have. And then our end, then if we tell a patient there might be multiple procedures needed over time, then we're not so scared, oh no, what if it doesn't work? Or let's say you do some implantable drug delivery type of product, and we know it's not going to last forever. And then what happens in 6 months or a year and a half, whenever it wears off, we tell a patient, okay, it's okay, we knew it was not going to last forever. Now we have something else we can do for you. I think having the understanding that we have these products at our disposal and the understanding that no one product is going to live and work forever for everybody, I think allows us to feel more comfortable utilizing the multiple different technologies that we have at our disposal to, again, be proactive, achieve and maintain the highest quality of life, as well as still be aggressive and not waiting till people have obvious progression before we intervene.